Okay, hi everyone. Tonight we have a special guest who's agreed to do a short interview with us and share his perspectives with us, and that's Sikhonangenkosi Ngcobo. Score and I have enjoyed interaction from the time he was a student and is now a past graduate of physiotherapy within the Department of Health and Rehab Sciences at UCT. But in our discussions, SCORE has really embodied for me some of the values of occupation-based community development in his work as a physiotherapist. And, you know, OBCD is about thinking about shifts in human connection and also thinking about shifts for people in terms of what we need to do as health professionals so that people's daily lives and the things they do every day can really change. And for me, in all of the discussions that Score and I have had previously, he's always really thought about how his practice needs to embody those values and move us differently towards that point. So we felt that it would be really great to have Score share some of his views with us, and he's currently in ComServe, and I'll ask him to introduce himself and where he's currently working as we start, and then we'll have a couple of questions to just kind of get the conversation going around where we need to be thinking as health professionals at this time where we currently find ourselves in the COVID-19 pandemic. Welcome, Score. Thank you for joining us.
Thank you for having me, Liesl. Thank you.
Do you want to just start by sharing, Score, where you're currently working?
Okay, so I'm doing my community service at a district hospital called Mbongolwane District Hospital. It's in KwaZulu-Natal in your King Ngcobo district. So yeah, we're one of the district level hospitals alongside Ishowe Hospital that service the people in and around of Ishowe, Mbongolwane, etc.
Great, thanks, Score. So the first question that I wanted to pose for you tonight is really just to get to the heart of maybe what you've been thinking at the moment, but perhaps not yet had a chance to express. And that is what you have been thinking and feeling, but not saying with respect to the pandemic and what our role as health and rehabilitation professionals should be at this time.
So the one thing that I think I haven't been saying is that we're still very caught up on a very biological model of healthcare in South Africa. And we're paying less mind into the social factors. And COVID-19 has really pointed that out because I think we've honed in too much on preventing its spread, that we're not looking at the social costs that prevention of spread is coming at. So that's been one of the things I haven't been saying, which then leads into the thought that I think I don't think we were ever ready for such a huge shock to our health system because we already had quite a number of issues before the pandemic started, and the pandemic just amplified those and highlighted them. So those have been my thoughts and the things unsaid, I think.
Mm-hmm. So really pointing out the need to potentially have been thinking differently anyway, and now the pandemic really giving us a nudge to say that there needs to be a different model of practice happening here.
Very true. Yes, Lisa, you've summed it up very well.
So Score, I wondered then, following on from that, how you have been imagining we could respond differently to the pressing needs that you're seeing around you as a physiotherapist and really just as a citizen of our country at this time.
The biggest thing that I think we could do better is how we educate the general public about health, because it's been rather interesting how many people have access to a mask, but then either use it incorrectly or use it for brief moments of time, for example, to gain access to a public space, and then once in the public space, remove it. So that lack of understanding that this isn't an access providing gear, it's there to protect you in all times that you're outside interacting with people. So I think it's been very interesting to see that one of the biggest ways we try to educate people are through posters, but I've noticed how ineffective they are in the area that I'm in, because reading a poster isn't the first thing that comes to someone's mind when they enter the hospital or enter our department. So as much as the posters may be big and colorful and draw one's attention, when that isn't the most used mode of communicating for people, it then ends up being for naught, I guess.
Mm-hmm. So, Sco, I know we've had some conversation before about how we then perhaps need to think about what's part of a physiotherapy session with the people that you're working with. I mean, if you have any ideas for how you could potentially then approach that differently, you know, from the model of these are the techniques I'm here to do, and that's my task as a health professional.
So I noted this to you earlier when we were prepping for the interview, that one of the biggest restrictions I've been feeling as a ComServe physio is the lack of permission, I guess, if I can call it that, to do outreach clinics and any home-based visits. So that takes away a lot of contextualizing our service to the patient, because it's one thing to teach someone to do something in a physio department versus their actual home environment. So it's taken, for me, it's taken away a lot of that contextualizing the service to the patient and making it unique to their situations, because you no longer have that freedom to do a home visit and see, okay, in their home, this technique may not be as useful for a transfer, but maybe this might be better. And I think in the same way, we as health professionals are so used to asking the questions we ask patients that we forget that they don't come to them as second nature. No one takes mind of how wide their doorway is or how many steps they may have leading up to their house. So when you ask them this in person during a session, it's difficult for them to recall because it's not something they pay attention to in their day-to-day living. So the social distancing component and the prevention of spread has really taken that factor of making sure that your service is catered to the patient that you see.
Sure. Yeah, I think, Sco, you're also speaking to the need to remind ourselves that people aren't just patients, that they are actually full human beings.
Yes.
That are living lives and that we can identify with as people. And so if you had to approach your role in a more human-centered way, what advice would you give to others trying to do that, to really understand, you know, who are we as people at this time, and how do we need to think about the people who are the beneficiaries of our service?
I think the advice I would give is to really try to come down to the patient's level, because I've seen in my area, there's obviously a profound respect for any health professional, and therefore the power balance isn't the same, because the patient already has so much respect for you before they even have met you as a person, that there are certain reservations they may have when they're answering. So to almost just reassure them that you too are just a person and you don't hold all the answers. You're actually trying to form a partnership here. And I can't bring all the help up upon you. I actually need your help to make sure that you get the best care possible. So that would be my biggest advice, to approach it in a human sense, as one would approach a friend or a family member. and really make it personal in order to get the best for the patient.
Mm-hmm. And Score, if we had to think about advocating for what we think needs to be different at this time, what are your views on what our central message should be as a group of rehabilitation professionals who come from diverse disciplines? Is there potentially a central message? I'm putting you on the spot, but I'm just wondering, what your thoughts are on what should our voice be about at this time?
I think our central message is one of, we too are human, and we don't have any extraordinary powers, but we are human just like our patients are, and we want to do our best to help, but we really rely on the patients as well doing their part. But I think that to also make that possible, we need to be a lot more practical in our health education, because if people have no idea what we do and how we can help them, it's very difficult for them to come to the party.
And I think you're also pointing out the very important need, Score, for us to develop ways to think together with those who we serve in communities. So to acknowledge the not knowing on our part and the fact that we need one another to understand what to do at this time in a time when all of us are vulnerable and need to think differently. So I thank you for those words of wisdom, because I think they really help us to identify with one another as human beings, but to honor the knowledges that exist amongst those people whom we serve as well, and who could also help us to think differently about what our services should be about. Thank you so much for being willing to share with us.
That's very true. Thank you for having me once again, Lisa.
Thank you, Score. Goodbye.